I'm glad to be here.
If you want to introduce yourself and tell us what you do.
I'm Dr. Amber Hall. My practice is Village Pediatrics here in Las Vegas, and I have a second enterprise, my passion project, which is Artemis Luxury Wellness, also based in Vegas.
How long have you lived in Vegas for?
I moved here in October of 2019 from coastal Oregon, so coming up on 4 years.
What made you move to Vegas?
A few reasons, actually. Primarily because my nephew is on the spectrum. He was nonverbal until he was about 4, and during kindergarten, really through first grade, he was having a lot of struggles because they tried to put him into a neurotypical classroom, which is generally what the school districts will try to do, is to put children on the spectrum into neurotypical classrooms for the majority of the day, and it just wasn't a good fit for him because they were trying to make him not autistic. And so as a result of that and a few other kind of medical complications that came up, I just really felt like as the only medical professional in my family that I needed to be closer to my sister and my nephew. And I didn't want to live in Phoenix, that's where I went to med school. I didn't want to live in California because the taxes are too high and traffic and fires. And so Vegas seemed like the next reasonable metropolitan area that would get me close enough to my family, but also was a city that I was excited to live in. So I started Village Pediatrics at the end of 2021. And previously I had worked at a very high volume private practice here in town that I don't really have anything nice to say about, to be frank, so I'll leave that out. But I suffered a major injury in 2021. I had a femur fracture to the right. It was a pathological femur fracture. I was 42 at the time, so, and as you know, a pathological fracture of one of the strongest bones in your body at that age is malignancy until proven otherwise. So I underwent 2 surgeries, a lot of physical therapy, a complete $1 million workup for malignancy. And I was basically out of commission and completely disabled from April of 2021 until December of 2021. And it was really through that experience that I recognized that, no paycheck was worth sacrificing my physical and mental health for. And I needed, in order to continue in medicine, I needed to do things in a way that worked for me and in a way that was very different than what the system as it is designed to do. So I started looking into direct primary care as a practice model, which is, kind of relatively new on the scene, but there's a growing interest in it for sure. And I decided I was going to start my own thing and really laid the groundwork for establishing this very small, very personalized care model whereby people pay transparent monthly rates for direct access to me. And it's been hugely successful to the point where my practice is full. I have a wait list for patients. And I'm talking to other doctors about how they can adopt or migrate into this practice model because it's been just a game changer for, my satisfaction in medicine as well as my physical and mental health.
Can you explain what direct primary care means?
So direct primary care is a model of care whereby people essentially pay a monthly subscription, just like you would to, Netflix or Spotify or whatever else. But in this case, they're paying for direct access to a physician. So I have an electronic medical record system, just like any other doctor. My patients, when they sign up for the practice, get access to that. I do all of my documenting in there, all of my prescription writing, all of my orders. People can ask for refills on medications. They schedule online. They have access to a secure messaging app that's HIPAA compliant and completely encrypted, so that they can text me directly. So before I came here this morning, I was getting text messages from families being like, this 3-week-old baby is off, spitting up a lot. Is this normal? My other daughter wasn't like this, or and I followed up and checked in with a couple of patients that reached out to me yesterday who were vomiting. There's a stomach bug going around right now, by the way. But, just to check in and be like, hey, is so-and-so feeling better today? Yes, thank you for checking. And so people really appreciate that direct access to care, but this is something that insurance companies don't pay for. So I offer what I believe is a fair monthly subscription rate, and people get unlimited access to asking me questions by telehealth. I only do house calls, which a lot of parents, especially of infants, really appreciate. And it works really well for me, and it works very well for them. Going back to the larger direct primary care question, there are a lot of doctors in town who are beginning to adopt this practice model, and everyone else aside from me has office hours. So depending on the practice that you sign up with, there are some direct primary care physicians that offer rates less than $100 a month. And you can use a health savings account, a flexible spending account, so that is auto-billed every month. And when you need to see a doctor, if it's something that can't be handled by telehealth, or it's a visit that needs to happen in person, these doctors have office hours and people scheduled to go in. The overwhelming majority, especially of adult doctors, don't do house calls. That's something that is unique to my practice.
So how did you find out about that model? Because it's not a very typical thing.
I had a lot of time on my hands in 2021 when I was disabled and basically not able to even get to the bathroom without help. And so I did a lot of reading online, and it was a practice model that I came across in the wilds of the internet. I started actually following, there are a few groups on Facebook now, the only thing that Facebook is really good for anymore is groups, right? But there are a few groups on Facebook of physicians who do direct primary care. And one of these groups specifically is pediatricians who do direct primary care. And so I requested to join and started following and paying attention to what they were doing, and really just learned from these other doctors who had adopted this care model and were making it work. And there are doctors from Long Island to Pasadena that have adopted this practice model. And I think as a physician, it's been really cool to build this community of other like-minded people who are hey, we went into this because we're humanitarians, because we like taking care of patients, right? We're good at science, but we want to spend time with patients. And so these physicians who are very much a like mind when it comes to patient care have been incredibly generous with their knowledge base. And these are the steps that I did. This is what I learned. This is how I learned to navigate vaccines, how to get access to vaccines, how to join a physician buying group to get discounts on supplies and medications. These are the hiccups that I ran into with how to design a clinic, or these are the mechanisms I used to market and let people know that this service is available. And so I really have now gotten to be part of this community of other like-minded doctors, so that when I have families who are hey, we're moving to Austin, do you know anybody who does what you do over there? That I have a group and a community that I can reach out to and be hey, I have this family, they're really great, they're moving to your area, do you have the bandwidth in your practice to take care of them?
That's awesome. And I think from an adult versus a pediatric kind of standpoint, you have a lot of different things to navigate, in terms of vaccines, like you mentioned, just overall new concerns for maybe new parents. Mm-hmm. And I'd say the third thing is milestones, right? So understanding and kind of teaching those things that I think from a developmental standpoint, a lot of times it's not always clear for people who maybe don't have experience doing or just, I'd say from a psychology, taking psychology and learning how the human body kind of matures and develops. So I guess tell us more about maybe what that looks like, or maybe what's different from the traditional model of okay, crawling, what is crawling so for sometimes you might be doing that, and kind of tell us how that would be different from a traditional how you used to practice till now.
So developmental milestones to me I think they're really exciting, and the overwhelming majority of the patients in my practice came to me when mom was still in the third trimester of pregnancy. And I tell women this, when you've made it into the third trimester, you really need to be looking for and lining up a pediatrician, because there are a lot of doctors out there, but finding someone who's in an alignment with the care that you're looking for what's going to be the most important person in your life, that takes time, it takes effort, and people like me have wait lists. And so that said, I see the vast majority of my patients, because my practice is in its infancy, I see them from, fetal stages. I'm one of the first people who knows when women deliver, and I see them from the minute they're out of the hospital, like all the way through. And I've got kids who are like now going into like kindergarten. And so I think having the type of relationship that I have with these families is really special, because, I've had parents bring things to my attention as early as like a couple of months and be like, is this normal? And because I do have experience, because I have a nephew who's on the spectrum who was nonverbal until he was 4, I have lived experience with autism and with neuroatypical development and with ADHD and all of these things. And so I kind of know what to look for early on in terms of behaviors. And there are some subtle things that I've noticed in kids as young as 4 months old that I'm like, I have my eye on this kid. And there are a lot of things, because there's a high level of anxiety amongst parents of like, is this a sign of autism? Like he doesn't like loud noises, or, like he's not making eye contact. Is this a sign of autism? And I think just by virtue of the volume of kids that I've seen across my career, including in training, and the depth of my experiences with kids now that I have an hour to spend on a visit, I am very clear on like, this is not atypical development. Like this is normal, or this is something that I'm going to keep an eye on, and I want other eyes on this kid too. So those developmental milestones, like everybody kind of makes progress within a window of what's within normal limits, but there are certain things that I definitely will put a kid on my radar.
What would be some examples for something like that?
So kind of big ones are vocalizations. Like I have a few kids who just turned 12 months old, and they're often, not really using language in like a meaningful way, but they're babbling sort of intentionally, versus like screeching and squealing and grunting. And there was a little girl that I took care of once who would just like rub her face repeatedly on like the netting in the playpen. And it was very clearly like, to me early on, like that's evidence of stimming. She's like sensation seeking, flapping, spinning, not making eye contact. And there's also like sort of subtle ways that kids interact socially with their parents, like early in infancy, where even during like a 2-month, a 4-month, a 6-month visit, I'll notice that an infant will look at me and, engage in a social smile at 2 months, or like a social laugh at 4 months. But they're grounding to their parent. They'll continue to, they'll engage with me, but then they'll look back and make sure like she's safe, right? This is okay, right? Like, and sometimes they'll like pull away from me and go to the parent, and that's totally normal. And because I do house calls, and because I have unlimited amounts of time with kids, I can really sort of follow their lead, which makes me, I guess, more adept at picking up on these subtle nuances in a way that I couldn't do when I had, a 10-minute scheduled appointment in a clinic that really was only like 5 minutes of meaningful time with the family.
I think if you calculate that, right, if you had 60 minutes with a kid, mm-hmm. that's equivalent of like 6 visits, mm-hmm. essentially. Like if you had 6 visits that you would go and see your pediatrician, like that would be the equivalent of that hour that you got to spend. So like you got to have a lot of valuable information within that time period. And I think that's where you get a lot of benefit, because the equivalent of going to 6 pediatrician visits or just doctor's visits and having that, it's like really infrequent. Like, oh man, I forgot to ask whatever question that you had, and then you probably won't be able to get the answer until the next appointment or whatever that is, and then it's just time that lapse, and you're like, oh man, I didn't get my questions answered, or something developed over that period of time and you weren't able to communicate that or tell your physician your concerns or needs.
Yeah, and even in training, they trained us to say, well, you're here for this reason. If you have other questions, you need to make another appointment for that, because the more frequently you go back to the clinic, the more the clinic is getting paid from your insurance company. So like, don't add, like, if you have a snotty nose, we're not doing a well visit on the same day. And if you're getting vaccines that I'm not talking to you about behavior, you need to make a separate appointment for that. And these are all sort of like structural implementations to increase the bottom line of the clinic. And the overwhelming majority of clinics are for profit and like run by hospital systems and private equity firms and all these things, right? But like, the structure is built to capitalize on people's questions, and and parents and families and adults are leaving their doctor's offices saying, well, I didn't have my question answered, or like, he didn't really go into the level of depth that is going to get at what my real problem is. And it's because those structures are in place. They're designed to do that because they're designed to make money. And I think the unfortunate thing is that because doctors are the face of that structure, patients are like, I hate doctors. I hate going to the doctor's office. And, like, I'm not the bad guy here. Like, I'm working in a system that was built to monetize your medical needs. And so there are like, doctors are being murdered in clinics, they're being shot, they're taking their own lives. We have higher rates of divorce, suicidal ideation, depression, anxiety, way higher than the general population. And this is why more and more doctors are choosing to leave the system and go into direct primary care, because they're starting to see clearly that like this game was designed by somebody who didn't have my best interest in mind as a professional.
And you probably notice too, the extended amount of time that you get to spend with your clients, you get to know them really well personally. So a lot of times too, the things you normally wouldn't have asked organically will come up now because you have the time to spend with them and you notice something.
Absolutely.
You also get to establish a baseline for that patient where this is what's normal for this kid, and then I come in today and now they're not normal for them individually, whereas that might be normal for another kid their age, but not normal for them as an individual. So I think that people might not always know or understand, like, being able to spend that much time, how much more information you can get from each patient.
Right, absolutely. And so, like, I'll use the example of like 3 and 4 year olds. I love 4-year-old people. I think like 4, 5, and 6 are my favorite ages. I love kids that age. But like, when I go in and they're like bouncing off the walls and the parents are like, do we need to be thinking about ADHD? And 6 months later, and I come in and it's like they have a fever or they're vomiting or they just seem a little out of sorts. Like, the difference to me is stark in a panel of patients of like 100 to 150 versus like the 2,000 plus kids that I was responsible for taking care of in my previous life. And the other important thing that you mentioned, so not only am I noticing more subtle behavioral things in kids, I also am having these conversations with parents. So that's where I get into like postpartum depression. How is your body feeling? Like, how are you recovering? Have you regained urinary continence? Like, how is your relationship with your partner doing? How are you navigating that? Now that you feel like you're basically just a source of nutrition and caretaking for other people, like, how are you reconnecting with yourself? And how is this transition to parenthood affecting the relationship between you and your partner? Because I've seen like several families whose relationships didn't survive those first 5 years of parenting. And so these are things that are very important from the standpoint of people's well-being and the health of their relationships that you just don't get into in a traditional clinic setting.
I think it's a really interesting way to look at it, because as a parent, the number one thing, this is my personal opinion, is to take care of yourself, right? As a parent, right? You have to take care of your individual needs. Obviously, it's your child can be very important, but you also have to take care of yourself in order to be a better caregiver for your child, right? So I think that's a really, really good way to look at it, because addressing those concerns and needs can also help the child become a better human. Let's just say, based on, better sleep, right? They have better nutrition. They can think clearly. They can do the proper development that they should be able to do, but not in an environment where it's stressful or it's chaotic, or things aren't emotionally charged, if you will, because the human or the mother or the father isn't in a good place mentally.
Right, absolutely. And I agree with your point, and I'm going to add to it. So, in the plan, they tell you, like, put your own oxygen mask on before you help somebody else, right? And it makes perfect sense. But I think that the medical system and the culture in general do a very poor job at preparing people for what parenthood actually looks like, especially in those first 2 months. Because, and I tell pregnant people this during that 3rd trimester, I'm like, take a weekend, like enjoy cuddle time with your partner, like take a bath, take a nap, read a book, like enjoy this, because when that baby comes home, all bets are off. Your sleep schedule is going to be chaotic and your body's going to be in pain. You may or may not be recovering from a C-section. And, it's not this like soft, focused, filtered Instagram reality of like this cute baby. Like there are going to be days when you just want to sit and cry, or like the one thing in the world that you just really want is like a 30-minute long shower and a nap. And that's not going to be, unless you have the means to afford some like very high level help in the house, that's not going to happen for people. And so I agree with you, like, yes, self-care is a really important part of parenting, but it's, for a lot of people, that's not a part of their reality, especially in the first 3 months of life. And I think that as the baby's doctor and as someone who's recruited during pregnancy, I try to prepare people for that, because, the first 3 months of life, it's like the days are infinitely long, but the months fly by. And then you're in the next chapter, and then they're like walking and talking and like pulling out drawers and throwing food off of the high chair. But like those early days can be really grueling. And I think it's hard for women. Like, yes, the idea of self-care is there, but the reality of making it happen is really, really hard.
Another thing about going to people's homes too, you actually get to see the kid like in their environment.
Mm-hmm.
And I would assume that would be probably a more natural setting for them than going to an office.
Absolutely. And it's a lot of fun for me too, because I can kind of like assess the sleeping quarters, and like I'll look around the house and be like, okay, so this is 6-month visit. Baby's not really mobile right now, but by the time they're 9 months old, they're going to be crawling across the floor to greet me at the door. So it's time to get gates for the top and the bottom of the stairs, and it's time to get the little bouncer things on the corners of the coffee table, and and I'll do an assessment and provide recommendations. Like, okay, one of the most common things that I see in 6 to 9 month olds is rolling. Like I get that call all the time, like, oh, he rolled off the bed, or I just turned my head for a second just to grab the wipes and he went from the couch to the floor. And so I can say, all right, well, you guys have tile or marble flooring, and he's about to be to the age where he's going to roll off the couch. Think about getting some thick rugs. So yeah, there's a lot of environmental assessment that I can do, and like pools in the backyard, because a lot of people in Vegas have pools. Like, it's time to get the contractors out and put up the gate, or here's the number of an infant swim coach, and they'll start teaching kids to like flip in water at 6 months of age.
The education portion is also huge too. Having that extra amount of time, then you could kind of like coach parents even like what to do, like you just said, or even like what to look out for in the future, or this is what the next visit entails. So instead of just only being there because, oh, my kid's sick, you can actually give them like previews of this is what's upcoming and these are things to look for.
Absolutely. And in pediatrics, we call that anticipatory guidance. And it's like a checkbox that you learn in residency, like this is what to look out for. But I do that at every visit, and I talk about milestones and like, okay, well, they're smiling at me, and this is a 2-month milestone, and the next time I come over here, I'm at 4 months, we're gonna do these vaccinations, and these are the milestones that I would expect. And the 4-month milestone is laughing, like social laughing. And I've had 4-month-olds who like, they'll pass gas in the bathtub and laugh about it. Like they start to have a little sense of humor at 4 months. So yeah, that anticipatory guidance and assessment of the home environment. And again, like checking in on the patient, on the parents' relationship, and like how they're adjusting not only to parenthood, but also how they're navigating parenthood together. Because like as a team, you're not always going to agree when it comes to how to parent this child, and how do you work through that?
What made you want to be a pediatrician?
So my background in med school was actually, I was interested in women's health, and I thought I was going to be an OBGYN. I love taking care of women, I love talking to women, and I loved delivering babies. I did not like being a surgeon. And so when I was in med school, I did all of my electives in like gyn-oncology and high-risk pregnancy, maternal-fetal medicine, pelvic floor reconstructive surgery. And when the rubber hit the road, I was like, I just don't want to be a surgeon. It's not my natural skill set. I'm going to have to work very hard to get good enough at not tying. And, you know, the other reality is that I knew myself well enough to know that when the day came that I lost a mother during childbirth as a result of something that went wrong, whether it was in my control or not, that was going to have a toll on my mental health that I probably would not be able to withstand. And so for those reasons, I decided not to be an OBGYN. I returned to my original love, which was pediatrics. And I say original love because I did 2.5 years of research in pediatric endocrinology at the Children's Hospital in Denver. So I had that research background before I went to med school, and I knew I loved working at children's hospitals, and I loved talking to kids, and I loved being around other pediatricians because they tend to be like, you know, nice. People who work with kids tend to be nice people. So ultimately I decided to do pediatrics because it kind of like, I could still sort of take care of women and like be involved in like the pregnancy childbirth thing, but I didn't have to be a surgeon. And I'm good at fart jokes, and those never get old.
Never. I always shift a little bit too about like, I guess, critical time periods. It can be something that I would like to talk about, just because those milestones and or time in which you expose children to opportunities, or just like, I guess you can think about it in like pruning, right? If we talk about more like neurological type stuff, is like that's where kids learn, and they need to be able to do certain things at certain ages. And it's really important time that if you don't have that, you can't gain it back. So can you talk about maybe some things that you talk about with your families that you find that are like really important, or like consistent things that you say like all the time that you're like, I wish more people knew about this?
Yeah. So social emotional development is a big one, right? And I think that one of the common questions that I get is regarding like sleep training and cry it out, and you know, like how much, and gentle parenting, which has been like a huge trend recently. And from my standpoint, because I quit drinking when I started my practice for obvious reasons. I can't be a 24/7 concierge pediatrician and like be having a couple of drinks at Cirque du Soleil on the weekends. Like, so in doing my own kind of self-examination in the context of recovery, for lack of a better word, I have done a lot of reading. There's a physician named Gabor Mate who's done a lot of work in the arena of like substance use disorder and addiction and trauma. And he talks about addiction or substance use disorder as a very human coping strategy for dealing with the pain of existence, right? Like we all experience uncomfortable feelings. And sometimes it is like we want to not feel those uncomfortable feelings. So we use things like alcohol or Xanax, prescription medications, Ambien, gambling, sex, technology, dating apps, like pick your poison. But these are all sources of dopamine to help us to not feel the pain of what's going on between our ears. And from my standpoint, this like early childhood development and early childhood mental health has a huge like impact on how we learn to deal with stressful situations for the rest of our lives. And so teaching children through our actions that when they cry that they're going to be responded to by their caregivers, and teaching them, you know, as they move through later in childhood to express their feelings through words once they're old enough to have those words. This is why like toddlers are so challenging, right? Because from 15 months to 2.5 years, they don't really have vocabulary. They have a lot of emotions, but they don't have much in the way of meaningful use of language. So there's a lot of responsibility on parents in early childhood to teach children to cope with their emotions and to express their emotions and to feel those things and work through them. Because, you know, one of my pet peeves is like just always putting a screen in front of the kid every time they feel uncomfortable. Like, that's programming them, and it's teaching them to seek external means of making themselves feel better. And I understand, like, sometimes parents, like, a screen is necessary to get through a procedure or a doctor's visit or a trip or whatever, but there are a lot of these sort of like developmental things, not just motor skill development, not just fine motor control, but there's emotional development that requires a lot of labor on the part of parents.
So what's something you commonly see in your practice that you wish more people knew?
I think the most common thing is just the realization amongst parents of how hard parenting is, and that it's a full-time job and you never get a day off, and it's for the rest of your life. Like, there's no going back on that. And I think that there's a tendency in the culture to, you know, there's like this set of milestones, right? Like, as an adult who's a good person, you need to want monogamy. You need to want to share finances with someone, to move in together, to get married, to have kids. And I'm putting that in air quotes for a reason. And the reality is that, you know, having kids is one thing. Being a parent 24/7 every single day for the rest of your life is what it really means to have children. And I think that, you know, there are many, many people in the world who will put on the caveat, like, I love my kids, but man, my relationship with my partner will never be the same. And, you know, it ended up costing us our marriage. Or I really miss, like, just being able to have time to myself. Or I miss the way that my body was before I became pregnant. Or, you know, I have lost touch with my identity as a woman in the course of being a mother. And these are all sorts of like things that we don't talk about and that are very glossed over. And I think it's been really cool, and we can talk a little bit more about Artemis at a later time. But one of the things that I'm discovering through the vehicle of Artemis is that you can change the default settings, right? Like, you can still be a good person and be in a non-monogamous relationship. You can turn a monogamous relationship into an open relationship, or a relationship that involves very special guest stars from time to time, and do those things in an ethical way. If you want to be a parent, but you like the idea of co-parenting, like, you can live in an apartment building with your spouse in a different apartment with kids who come and go back and forth, so that each of you can maintain your own identities and have like free time to yourselves. If you want to be a parent but you don't want a partner, like, I've got parents in my practice who are single parents by choice. And there are plenty of people out there, especially in the LGBTQ community, who don't have biological children. They want to have children, and so they co-parent with someone either of the same sex or opposite sex, and like navigate these found family relationships in ways that don't necessarily employ the default settings. And that's what I think is really exciting about the time that we live in, and the patient like population that I'm dealing with, is that people are like, well, you know, why are those the rules? Do they have to be the rules? Like, the rules of a relationship are made by the people in the relationship, and those rules can change over time if you know how to negotiate them properly, and, you know, with love and compassion towards the people that you're interacting with.
What's something you've been working on, whether it's professionally, personally, or physically, or mentally, that you're excited about?
Oh, so this is an Artemis question. So my passion project, Artemis Luxury Wellness, grew out of my interest in women's health, my interest in human sexuality, and the fact that we're not talking about any of this stuff, right? Like, and our sexual health is very much a part of our overall physical and mental health. Like, I would make the case that we take better care of our bodies physically when we want someone else to find us desirable, or like, you know, spark someone else's erotic imagination, right? And there are hormones that are released in the brain, oxytocin and dopamine and epinephrine and all of these things during sexual encounters that are really nourishing. And there's a reason that, like, after you've had a good playful encounter with your partner, like, you have a little pep in your step and like you feel a little bit better about things, and like your day is a little bit better because you had that. The reverse is also true. Like, if folks are dealing with a dead bedroom and they're like just not physically connecting with one another anymore for a variety of reasons, whether it's parenting or, you know, just discord within the relationship, or, you know, ongoing rejection or whatever, like, that lack of physical and sexual intimacy in a relationship can take a huge toll on the relationship and on the physical and mental health of the people involved in that relationship. And so Artemis, the concept of it has really grown out of my medical practice, but it's a kind of a holistic approach to women's health and human sexuality, where I am having conversations with people and normalizing the importance of this, because so much of it is shrouded in just shame, right? And women are taught that, like, well, if you want to be good, you know, you can't be sexual. You have to not want sex because then you're a slut. Like, there's a lot of internalized like slut shaming and homophobia that goes into why our culture approaches human sexuality the way that it does. But through Artemis and the conversations that I'm having in that arena, I'm starting to kind of break that down and normalize that conversation, which is really fun. I love it.
Could you tell us about maybe the retreat you had recently, and just kind of what that looks like for a retreat, or, you know, things that you've done in the past?
Absolutely. So my first event was in May. It was a 2-day thing. I had people who flew in from all over the country for this thing. I spoke because obviously I can get on a soapbox for a minute. I had a pelvic floor physical therapist who's also a mom of 2 young children, who kind of talked about what childbirth does to our bodies and sort of like the remodeling and restructuring. She did a great anatomy lesson on like the analogous structures between male and female anatomy, because basically like the penile tissue and like the clitoral tissue are very similar from an embryologic and like developmental standpoint. And so she went into that, as well as like the emotional reactions and like the changes that come with early parenting. I had a clinical sexologist who talked about like female orgasm and squirting and G-spot, which again, like I never learned that in medical school. And she did it in a way that was very like playful and approachable and not salacious, so that people left and were like, we went home and tried that. Thank you. Thank you for teaching me how to do that. I had some kink professionals who like do teaching on like conscious domination and like the Japanese art of rope bondage and how that can be employed to really deepen the connection between partners. And people can also learn self-ties. Like they teach these workshops here in Vegas, and some of them are self-tie workshops. I had cirque performers, I had professional caterers. It really was like a very all-encompassing event where we talked about multiple aspects of human sexuality in a way that was approachable and fun. And then day 2, we just got a cabana at Encore, and everybody got to like socialize and mix and mingle and go to the pool, and it was lovely. And so my next event, I'm targeting the spring, but in the meantime, I'm considering doing some workshops specifically for women, like specifically regarding like women's health, women's sexuality. And I've also considered maybe doing like a kink workshop that's all about like conscious domination and how to approach BDSM in a way that is intentional and a way that's used as a healing modality, as opposed to just like whips and chains and, you know, some of the exploitative stuff that some folks in that community can be up to. But yeah.
Well, we appreciate your time today. We appreciate you being on the show. It's been very interesting listening to all the different things that you do. And I think it's excellent what you're doing, especially for the medical community. I think it's great to provide better alternatives for people, especially in the Valley. So we really appreciate that. We appreciate your time today on the show.
Thank you very much. I appreciate you inviting me to be here.
And how can people find you?
So my clinical practice is full right now, and I'm running a wait list, but that's villagepediatrics.vegas. Artemis Luxury Wellness, if they're interested in learning more about human sexuality and women's health, I'm at artemisluxurywellness.com. I'm on Instagram at Artemis Luxury Wellness LV, and I also have a YouTube channel, which is Artemis Luxury Wellness on YouTube.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.